The Kumasi Center for Collaborative Research, KCCR, has played a key role in testing samples of suspected cases of coronavirus in the Ashanti region. The center has so far tested 41,981 samples taken from routine surveillance, community screening, and travelers who were suspected to be carrying the virus. Ashanti Regional Director of the Ghana Health Service, during a briefing in Kumasi, said decentralizing testing centers will ease pressure on the KCCR.
It's our plan to decentralize the labs. So apart from Kumasi Center for Collaborative Research, we are also working with Ghana Health Service to set up at least 2 labs in addition to KCCR. One will be based in our public health reference lab in Kumasi South. And then we are also talking to Konfanochi to see whether we can use their lab. There are other facilities that is in Kumasi that we can put in shape. Example is the Hope Exchange Hospital. They have a lab, and all these labs, we believe that with the support of KCCR, we can now decentralize and get more laboratories so that the testing will go very fast. Because so far that has been the major bottleneck as far as our effort to combat the COVID is concerned.
17 out of the 43 districts in the Ashanti region have recorded COVID-19 cases. 56% of the cases are males and 44% females. Obuasi leads with 47 confirmed cases.
What we know is that the areas that have become hotspots are still the hot spots. Let's, for instance, take Obuasi as an example. Obuasi was the first to report a case in the Ashanti region, and as at now, they are leading as far as the number of cases are concerned. Young people always, and especially male, always want to take risks. How many old people do you see in town? How many old people? You see, when you are getting to a certain age, then your risk perception change. And when you go to town and you see what is going on, no, you don't have to dispute it. Because I can, even without any test, tell you that if people are going to get infected, then it's the young men. Some of them are still playing football now. We've had a number, some of them draft, and anytime you go around, you see what is happening.
Dr. Tinkrant says the issue of stigmatization is hindering efforts by health workers to fight the pandemic.
But one thing that we want you to do for us is to address the issue of stigma and discrimination, which so far has been the major bottleneck as far as our fight against COVID-19 in this country is concerned. People who go through the protocol and then are discharged, when they go home, they are usually faced with challenges. Even when we are looking for isolation center, we are being challenged in the sense that a lot of people don't understand what we are doing. So we will have to communicate the risk so that people will appreciate why there's a need for you to be isolated, why there's that need for you to be kept for 14 days, and after that we test you. If the community don't understand what we are doing, then they only resist what we are doing, and it makes our work very difficult. Anytime we are going to pick a case, there's always a fight. And some of them do not understand, and they resort to social media to discredit what we are doing.